A revolutionary IVF treatment offers hope against incurable genetic disorders. In a landmark advancement for reproductive and genetic medicine, doctors in the UK have announced the birth of 8 healthy babies using an innovative technique known as mitochondrial donation treatment, MDT, sometimes referred to in the media as three-parent IVF. This world-first success brings fresh hope to women at risk of passing on devastating, incurable mitochondrial diseases to their children. A medical breakthrough decades in the making. Mitochondrial diseases are rare genetic disorders caused by mutations in the mitochondrial DNA, passed exclusively from mother to child. These mutated cellular powerhouses can lead to severe developmental problems, including impaired brain, heart, and muscle function, often resulting in early death. The diseases affect approximately 1 in 5,000 newborns and currently have no cure. MDT aims to disrupt the maternal transmission of these mutations by combining the mother's nuclear DNA with healthy mitochondria from a donor. In practice, the mother's egg is fertilized with the father's sperm, then the nuclear DNA is transferred into a donor egg stripped of its own nuclear DNA but retaining healthy mitochondria. The resulting embryo carries nearly all its genetic material from the parents, but relies on mitochondrial DNA from the donor. First recipients: 8 healthy infants. In the latest milestone, the team at Newcastle University, the only licensed center in the UK for MDT, reported that out of 22 women who underwent the procedure, 8 went on to successfully deliver healthy babies, 4 boys and 4 girls, including a set of identical twins. One additional woman remains pregnant at the time of reporting. Though this method has been legal in the UK since 2015, these births represent the first major real-world success of the technique. The outcomes, published in the New England Journal of Medicine, mark the culmination of more than 2 decades of research and ethical groundwork. Health outcomes: no signs of disease. All 8 children are currently developing normally. Minor health issues were recorded in a few cases. One child had a urinary infection, another experienced transient muscle jerks, and a third developed a heart rhythm disturbance which was treated successfully. None of these complications are attributed to mitochondrial disease. Importantly, genetic testing revealed that mutant mitochondrial DNA levels in these children were extremely low, typically reduced by 95–100% in 6 cases, and by 77–88% in the remaining 2 infants. These levels rest below the threshold required to cause disease. Still, researchers caution that some maternal mitochondria may persist, suggesting further refinement of the technique is needed. Pregnancy and success rates. The team reported a 36% pregnancy rate following MDT among the 22 women treated. In comparison, pre-implantation genetic testing (PGT) alone, another standard technique used when eggs vary in mutation level, yielded a 41% rate, 16 pregnancies from 39 attempts. The slight difference reflects the reality that mitochondrial mutations may impair fertility, necessitating further study. Patient perspectives and societal impact. For families affected by mitochondrial disorders, which often recur across generations and are currently untreatable, MDT offers transformative hope. As one relieved parent explained, "All we ever wanted was to give our child a healthy start in life. Science gave us a chance." Advocacy groups such as the Lilly Foundation, founded by bereaved families, view the breakthrough as deeply significant. Meanwhile, scientific leaders caution that while the results are encouraging, long-term follow-up is essential to monitor for any late emerging effects. Ethical and regulatory context. The UK remains the only country to fully regulate MDT with a legal framework, granted in 2015 and